CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. Everyone's medical situation is unique. As we age, our values, wishes, and overall health determine the kind of care we want and need. So when you're making plans for future care, it is vitally important that everyone involved is on the same page.
Well, I think that having the same goal is very important when you are moving towards better health or sustaining health as long as you can. And so that has to have communication. You have to talk about it. The person to whom that is occurring to, they have to really be clear about what their goals are. Do I want to have surgery? Do I not? Do I want to seek this particular plan of care or do I not? And then communicate that with as many people as possible. If it's family members, if it's friends, if it's a professional caregiver, making sure your primary care doctor knows, making sure the people at the hospital where you're receiving that care know what that ultimate goal is. But it's really important that we decide ahead of time what we want, so that requires some thinking and some really serious consideration, and then expressing those wishes. Formally through advance directives, informally through maybe a family meeting or a meeting with your primary care doctor and your caregiver and your family members. You know, it's that communication, however that takes place, and being organized ahead of time. These aren't things that are happening in that crisis moment. You don't have time to make those decisions in crisis.
Kate Jones is the Chief Clinical Officer for Amedisys Home Healthcare. Thank you for being here, Kate.
Thank you for having me.
Now this story hits home for you.
It really does. Even though I'm a healthcare professional, I often go to my own personal experience when I think about values of care and personal choices around care. So the example my parents live in upstate New York. My dad's in his 90s, my mom's in her late 70s, and she is his caregiver. So when my mom suffered a fall and a fracture about a year or so ago, I knew from the multiple conversations I had had with her that what she wanted more than anything was to get back to the level of care that she would be able to continue to care for my dad. So when the physical therapist came and did an assessment, the physical therapist didn't ask her that question. What was her goal of care?
And she knew. You'd had the conversation. You took the preventive actions so that you knew, or she knew, what your father wanted.
Exactly. And, I was able to have that conversation with her and the physical therapist together. So it wasn't about being able to walk down the hallway. It was about getting well enough to be able to continue to care for my dad.
Right.
And then as the year has progressed, so that's been about a year now, my dad's health has continued to decline. Her goal of care now for the two of them is that they be able to stay together for as long as possible.
It's not an option for them not to be apart in her eyes.
In her eyes, it's not an option. Now, there are 7 children. We may disagree with what her choice is, and we may be having to do a lot of planning and helping them with in-home care and all kinds of options to help them be able to stay at home. But we're supporting her goal for as long as we can.
And there are options available. It depends on your finances. It depends on collaboration and integration.
It really does. And so I think the key really is talk about it. What are your choices? What are your preferences ahead of time? Because if my mom and I had not had those conversations, there are times over the last year where I would have made different decisions maybe if it was my choice. But because I knew what she wanted, we've been able to go through the last year really in a way that supports their goals, but at the same time is making sure that my dad gets the care that he needs.
So you've been cohesive.
Yes.
One unit trying to make the decisions together and make it happen.
Absolutely.
Thank you so much for being here, Kate.
You're welcome.
For more information on your home health care options, call the Amedisys information line at 1-877-877-8145. You can always go to our website for more information, to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.